18%. That's roughly 1 in 5 claims. Most of these policyholders have no idea whether the rejection was valid or what they could do about it. Healthcare insurance policies in India are 30 to 50 pages of dense legal language. The average buyer would read about 4 to 5 pages before signing. So when the claims get rejected, citing a clause about pre-existing conditions, waiting period, or a non-disclosure, the policyholder is lost. They don't know if the rejection is correct. They don't know whom to appeal. CareBridge was built for that moment. CareBridge has 3 tools. The first is Pre-Purchase Analyzer. You paste in your policy documents. CareBridge reads it and returns a plain English breakdown of 10 critical clauses. Waiting period, pre-existing disease exclusions, room rent cap, co-payment terms, and many more. Each one is rated high, moderate, or low risk. There's an IRDAI compliance score, checking whether the insurers met their regulatory disclosures obligations. And there's a buyer's checklist, so you know what to ask before you sign. And an AI chat assistant grounded in your specific case. All of this is run locally, no data leaves your device. The second tool is post-rejection audit. Herein, you paste your policy wording, rejection letter, medical records, and your explanation. CareBridge identifies which clause the insurers applied and whether that application holds up against IRDAI standardized definition. The audit returns a step-by-step re-application guidance, relevant IRDAI regulatory context pulled from local knowledge base, and an AI chat assistant grounded in your specific case. This is where MedGemma AI matters specifically. Medical records contain clinical language like de novo diagnosis, post-acute onsets, and no prior consultations. A general purpose model treats this as in surface language. MedGemma's medical pre-training understands what they mean clinically and whether they contradict the insurer's pre-existing disease assertions. The compare feature helps users choose between two health insurance policies with clarity. It analyzes both document clause by clause, generates a score, highlights risks, advantages, and transparency differences, and then recommend a stronger policy based on consumer safeties and compliance. The Learn and Get Help section educates users about their insurance rights and guides them when they face claim issues. It provides simplified IRDAI regulations, explain key policy terms, and offers step-by-step escalation pathways. Users can access helplines, the grievance portal, ombudsman support, and free legal aid resources. One thing we want to be clear about. CareBridge is an education and navigation tool, not a legal verdict engine. The appeal direction indicators tell you where your case stands relative to your clause and the evidence. It's a starting point. System routes every low confidence case to a human review. IRDAI, IGMS, the Insurance Ombudsman. The goal is to get policyholders to the right door, not to replace what's behind it. CareBridge runs on MedGemma AI, private, API free, and secure. No third-party AI service, no data resale, no storage of documents. Built for 520 million Indians with health insurance and the millions who understand their policies only after rejections. Thank you.